Carpooling with Ben, folks. We are back in the car, and I am so excited. I've got an amazing doctor in here because we are in Movember, and folks, we want you to pay attention to Men's Health. Doc, I am so glad you're here. Dr. Brian Murphy of Rhode Island Medical Imaging. Sir, it's great to see you.
And you, Ben. Thanks for having me.
It's great. He is, if you can't tell, that accent, ladies and gentlemen, is from New Jersey. Just right up the turnpike there, and he's here. So, Doc, it's great to see you. How are you?
It's great to be here. I'm great. I'm very excited to. This is like all new to me. The lights. I believe it's your first time back after the break. So
it is.
fantastic.
Yes, and so it's exciting. You obviously you're not from New Jersey.
No.
Where are you from, and how did you become a doctor?
Okay.
Like, what was your path to get in? That's always interesting to me.
I'm from Belfast in Northern Ireland,
Okay.
which you may have heard of. It's been in the news, not so much recently, but it was in the news a lot back in the day.
I remember it in history books, yes.
Yes, exactly. So I'm from Belfast, and I went to medical school, oh my God, 40 years ago.
Wow.
So
You started when he was 10 years old.
I did, that's right.
10 years old.
Yeah, 40 years ago. Gosh, I mean, at some point, saying, oh, I've got 20 years of experience is a good thing, but when you say 40 years, it starts, it's like, maybe he's just, getting a bit old. But anyway, 40 years ago, started medical school, went to medical school first. Once I'd done that, I got interested in radiology, which is what I am now, a radiologist, which is, they're the people who look at the scans. If you get like a CAT scan or an ultrasound scan or an MRI, they're the people, the radiologists are the ones who look at those studies, interpret them, give an opinion as to what's going on, and then your doctor then decides what to do with the information that we get from the scans. So I started to do a radiology residency, which is 4 years, and I did that in Dublin, and then came to Boston to do my fellowship, which is like specializing in a certain area of radiology.
Right. Yep.
And I specialized in body imaging.
Okay.
Which sounds like, isn't all radiology body imaging? I guess it is, but the body is, in radiology, is like your abdomen and pelvis. So it's basically your liver, your spleen, your kidneys, all that sort of stuff. And so that I finished that in Boston. I stayed there for a few years after the fellowship and came down to Rhode Island with Rhode Island Medical Imaging, or Remy, in 1998. So that's 23 years at Remy.
And you've got a wonderful family, and you're active. You're all like you are here. You live in the Rhode Island dream.
I'm loving Rhode Island. No regrets at all.
Well, we're glad to have you, and obviously Rhode Island Medical Imaging, RemyRad.com. If you're looking online, we're talking about Movember. Now, This is a relatively newer term. It started where guys were kind of growing out their beards and stuff, and mustache Movember and everything. But I love what you guys are doing, the amazing staff and doctors and everybody over at Remy, because you're taking it as an approach to really push men's health.
Right.
I mean, it's so important. And now that I'm a dad, I probably should make sure I start taking care of myself even more so.
Right.
So talk to me, what is Movember and what is Remy doing?
Well, as you say, I mean, it started, I think it was just a bunch of guys in like Australia growing their mustaches to draw attention to men's health.
Yeah.
And it snowballed and mushroomed, whatever the right expression is, and now it's like a worldwide thing that November is like, it's almost like it's Men's Health Month. Mm-hmm. And some men do grow their mustaches. I see you're actually sporting. Are you growing?
Yeah.
Is that gonna go further?
No, it can't go further. I'm not even supposed to have this with the fire department. But nonetheless, it's I've got a little bit of stubble there. So
if I could grow a mustache for Movember, I would. But I can. But unfortunately, it is snow white with a red patch in the middle. It looks like tomato soup all the time. So
it happens.
I'm not doing that. But you can do other things to draw attention to men's health issues. And Remy. Men's health it's not just about men's specific issues. Like, we obviously testicular cancer and prostate cancer and suicide is actually a big part of men's health to be considered. We can talk some more about that. But at Remy, it's about the big killers, if you like, the big diseases that we get. So if you think of the number one killer of men, it's heart disease.
Yeah.
So one thing we do at Remy for that, we do what's called calcium scoring. Okay. So how this will work is you go to your doc or your provider, and you find out if you have any risk factors like high blood pressure, diabetes, if you smoke, if you've got a bad family history, you've got high cholesterol, all that sort of stuff. And if you have certain risk factors, they may feel that you're suitable to have this screening test, which basically looks at your heart, looks for hardening of the arteries, and gives you an actual score. That's the calcium score.
Okay.
And the score will tell you whether you're good to go, if there's no calcium there at all, there's a little bit, and you might need to alter your lifestyle, stop smoking, look after your diet, look after exercise, get your cholesterol under control, all that sort of stuff, or whether it's severe enough that you might need to see a cardiologist. There may be something, because this is all about early detection.
Sure.
There's prevention, which we all know about prevention. You got to watch your diet, you got to exercise, you got to do this, you got to do that. We all very aware of that stuff, even if we don't necessarily do it. But this is early detection, so early detection of heart disease before you actually have symptoms.
Okay.
So, as I say, heart disease is the number one killer, and calcium scoring is a very easy and straightforward way. You basically go in, you don't need to prepare, you don't have anything injected, you don't drink anything, you just lie in the CAT scanner, which is one of those donut, I call it the donut of truth.
Yeah, sure, yes.
And it's like a big donut thing, and you basically lie there, it goes, and maybe, start to finish 10 minutes, and you get this score. So, heart disease is a big one. Cancer-wise, the biggest killer of men still is lung cancer.
Okay.
Which is kind of surprising me that enough people are still smoking, because it's a disease of smokers. Occasionally non-smokers do get it, but it's really smokers that get it, and that's another thing we can screen for at Remy if you're a smoker. So
we're talking about a lot of these different things that we're doing the screening for, and this is, I think it's that typical male mind. It's I'll go when you've seen it on every sitcom growing up. It's like, all right, finally I can't move, so I guess now I'll go to the doctor.
Right.
But especially if there's some kind of a family history with any of this stuff, whether it be heart disease, whether it be anything to do with the lungs, whether it be whatever, the early detection is key. The technology that's out there is incredible. Talk to me a little bit about, the experience of, if I was to go to Remy, if I was to set up a consultation and say, look, I want to get checked for blah, blah, blah. When I go there, a lot of men, they don't want to admit it, but they're nervous. With good reason. They don't know. Talk to me about that process. How do you kind of take the edge off?
Yeah, I mean, it is a good point that, men are nervous. I mean, it's kind of seen as a macho, manly, for want of a better word, thing to deny problems, but it's actually at its heart it's because you're nervous. I've got a friend of mine's dad smokes like a chimney, and every time I see him, I say, has he got his lung cancer screening yet? Because he's eligible by criteria to get a lung cancer screening CT, and I've taken the step of handing him the leaflet that explains it, and the dad just won't go to get it done. And it's denial. He doesn't want to find out there's something there, Right. So men are nervous about that sort of stuff, and that extends to when you arrive. But I mean, our techs are absolutely fantastic. I've been on the other side. I've had studies at our own place, and I don't think they were being particularly nice just because it was me, but they were really kind. And the studies themselves are no big deal. I mean, like this. The calcium scoring and the lung cancer CT screening is very straightforward. You literally go in, lie there, and the scan is done. Even now, one of the side effects of COVID is that we don't have a packed waiting room. You arrive in your car, let us know you're there, come straight in, get it done, and it's so quick and so easy and so simple. And I guarantee you that if you get it done, the first thing you're going to say is afterwards is, what was I worried about?
Yeah, exactly. I got to say, the waiting in the car thing, to me, is like one of the best things that's come out of the whole COVID. Because... Oh,
let's talk about good things that have come from COVID.
Nobody likes to go in, especially guys. Well, I shouldn't say that. Me.
Yes. Me too.
Especially when, I have to go in there and they have General Hospital or Days of Our Lives on the TV in there. It's like, what are we doing? And you don't want to put on Family Guy or something that might offend other people, even though you're going to laugh. And then you look like the all-time egomaniac if you have your earbuds in or headphones on as you're watching on your phone.
And then you don't hear when you're called.
Exactly. So you can be in the car, You check in via the text. It can't be any simpler.
It is awesome.
And then you go in. It's a wonderful thing. And I can have my coffee. Well, you probably need to fast and do all that other stuff.
No, you don't actually. I mean, most of these things you don't.
Really?
Yeah,
Okay.
like the lung cancer screening, the calcium score. Nothing's injected, nothing's drunk. There's literally no prep for those. So you just go in, get it done.
So I can have my coffee.
Yeah, you can have your coffee. You can bring it right in. As long as you don't spill it, you're good to go.
Well, you ruled me out on that.
The only thing you do need, one other thing I did want to mention is, another leading cause of cancer death, I think, is number 3 in men is colon cancer.
Yeah.
And how old are you, Ben? You're a young guy.
I am 40. I am 40 this year.
Hard to believe.
1981 was a good year.
Hard to believe.
Absolutely.
But that's the year I went into medical school.
That's right. Again, 7 years
sorry,
old,
I have to
ladies and
process
gentlemen.
that for
It's like
a second.
Doogie Howser over here.
Exactly. Anyway, so for colon cancer screening, you're too young for most of these screenings, but for colon cancer screening, we do a thing called virtual colonoscopy. I'm sure you're familiar with regular colonoscopy.
Yes.
You go in and you have a scope put in your bum, and it goes
Sure.
the whole way around your bowel, looking for basically you're looking for early colon cancers, little polyps. What we can achieve a very similar degree of examination of the colon, but we just put a little small tube in your bum, and you don't need sedation.
Okay.
You do need the bowel prep. That's the only thing. You still
Sure.
need to do the bowel prep, which for most people is the worst part, to be honest with you. But you don't need to be sedated. You go in, you get a small tube in your bum. Your bowel gets inflated with carbon dioxide. Which is easily absorbed, so that's why you don't get cramps and you don't embarrass yourself too much afterwards. And then you do a CAT scan, and you get these incredible pictures which look very much like a colonoscopy. And that's one way to screen for colon cancer. If you're over 45, that's one thing. So you don't have that long.
Okay, yeah.
Once you're 45,
Sure.
It used to be 50, and now they've reduced it to 45.
Sure. Well,
so this is, sorry, go on.
Yeah. That again, you talked about it. Early detection
Absolutely.
is absolutely key. It is so important with anything. So that's great, and it seems like more and more it's years ago the procedures were a little bit more invasive or just a little more intensive, but this is great. So what's my first step?
Most of them you need to go through your provider.
Okay.
So, and I think that's a good place to start. If you're talking about men's health, you're talking about people's health, women's health, anyone's health. First thing to do is to reconnect if you haven't been recently with your primary care provider and get screened, because there's more to this than just radiology. Obviously, you need to have the blood test, the examination, check your blood pressure, all the basic stuff to begin with. So that's the place to start. And then when you're there, the way always you see in all these ads, ask your doctor if so-and-so would be right for you. Ask your doctor or ask your provider what sort of screening tests you should be getting.
Okay.
Because you can't say, if you have no family history, you don't smoke, and you exercise well and you eat well and your cholesterol is normal, you don't need to get a calcium score, for example. But if you have a bad family history of heart disease, if you have a high cholesterol and you smoke, then you may well need to. So you need to talk about this all on an individual basis.
Sure.
So you do need to talk to your doctor about that. Similarly, for lung cancer screening, actually, although you do need to get a referral from your doctor, it is covered by insurance if you fulfill certain criteria. So, so obviously it's a disease of smokers predominantly. So if the rules, if you like, are you need a 20-pack year smoking history, which is a pack a day for 20 years, or 2 packs a day for 10 years. You need to be over 55 and under late 70s. And you need to either be still smoking or have given up in the last 15 years. So if you have quit 10 years ago, you're still at a high risk for lung cancer. So you should be getting this low-dose CT screening every year. And again, you go to your provider and say, do I meet these criteria? And if so, they will give you a referral slip, and then Remy will set you up and get you an appointment.
Doc, one other thing that is very important is mental health, and it seems to be coming up more than ever because everybody just seems to be at their mental wit's end with everything that they've been through for the last almost 2 years. But also it's becoming normalized to talk about it, especially for men, especially because it's okay not to be okay first and foremost, but you got to talk about it, and that's what's critical, especially when it comes to suicide prevention. We need you here.
I mean, well, exactly. But I mean, I think you hit it on the head. It's okay not to be okay. I mean, it used to be a thing that men didn't complain about stuff like that. And that's one of the reasons why suicide is so high in men, and particularly middle-aged men, and in young men I think it's like number 2 after like non-intentional trauma like car accidents, etc.
Sure.
But suicide is like the number 2 cause of death. I mean, that just shouldn't be, you know. And you know, for men, I mean, there are so many resources now to help, even online. You know, you can get counseling online. You don't have to go to an office and see a counselor. I mean, you can get meaningful help online. You can reach out to your family, your friends. I mean, as you said, it's okay not to be okay. And you know, for your family, I mean, you've got to reach out if you have anxiety or depression, or particularly if any fleeting thoughts of self-harm. I mean, you should reach out as soon as you can. And that's a sign of strength to me, to reach out and you know, tell someone you're not okay and get treatment, because there is so many more effective treatments now as well.
Yeah.
You know, that are available readily. That you know, and something like 9 out of 10 people who do commit suicide had recognizable, you know, treatable illnesses. I don't even want to call them mental illnesses, because they're illnesses that, you know, perhaps their loss could have been prevented. You know, and when you think of the impact to the families, I mean, it's awful.
Yeah, so, and I like what you said there. It's not a sign of weakness; it's a sign of strength.
Absolutely.
To reach out, and you know, obviously, any medical professional facility, you know, has the ability, especially at Remy, you know, to put you in contact with the right thing. But it could be something else that's triggering it, because let's face it, the body, everything's connected. I remember that song. The head bone's connected to the knee bone, the ankle bone's connected to the shin bone.
It's possible, but I mean, most of these things are inherent, and most of them are treatable. And you know, even if you have to go to the emergency room, you know, to get treatment as fast as you can, go to the emergency room. They know what to do. They can put you in touch with the right people. But just, you know, stop and think, and you know, do something about it. Don't just let it continue.
Men's health, putting the men in mental health.
Oh,
you like that?
No.
Come on.
Yes.
That was great.
Yeah,
I thought
brilliant.
That was a good one, Don.
Brilliant, but zinger.
Folks, they say an ounce of prevention is worth a pound of cure.
Absolutely.
And I mean, I got the doctor here to tell you that and can attest to it. You got 12 great locations. They're spread throughout the state of Rhode Island. I mean, you're running second place to Dunkin' Donuts, which has, you know, I mean, 12 within the little span of driving that we've
That's the goal. That's the goal.
Absolutely. But folks, if you want to learn more, obviously you can go online. You can follow them on Facebook, on Twitter, Instagram, YouTube, LinkedIn. They're just like MasterCard. Everywhere you want to be, they accept MasterCard too. Cha-ching. So, Doc, it has been great chatting with you. I know you're not going to grow out the mustache for Movember, but perhaps for, I don't know, for a holiday, say like Thanksgiving, maybe you could wear a fake one?
Maybe I will.
You know, just you know, little studio tack there. And
if I'd thought, I would have got one, and I would have put it on halfway through our conversation, see if you noticed.
Maybe I can throw a filter on.
Yeah, all right. Oh, yeah, that would be great. I'll stay still, and maybe. Okay, there it is.
Doc, thank you so much. It's been great chatting with you.
And you. All the best.